Hello, my name is Dr. Ben Roper, and I'm a GP in the Vale of Glamorgan. You'll have probably seen or heard lots of information around Strep A, Scarlet Fever, and invasive Group A streptococcal, or iGAS. And it's natural as a parent to feel concerned, especially at this time of year when there's lots of cold and flu infections circulating in our communities. The best thing you can do for your child is to provide care you would when they have cold and flu-like symptoms, and familiarise yourself with the symptoms of Scarlet Fever and iGAS as a precaution. The NHS 111 Wales and Public Health Wales websites have up-to-date information on Group A strep, Scarlet Fever and iGAS. Group A streptococcus is also Group A strep, is a bacteria commonly found on the skin or in the throat. Infections caused by Group A strep are common in children, but most likely cause mild illness such as sore throat, known as a strep throat. These are sometimes treated with antibiotics. Group A strep can sometimes cause scarlet fever, where children have a high temperature, sore throat, and a rash with a sandpaper feel. This rash can be red in fair-skinned people or skin-coloured on darker skin. If you're worried about your child's symptoms, you can visit NHS 111 Wales online to check if symptoms are those of Group A strep. Your local community pharmacist can also offer advice. If upon checking the symptoms on NHS 111 Wales, you believe your child has scarlet fever, you should contact your GP or call NHS 111 Wales, who can then advise on the best course of management. In rare cases, more serious illness may occur in the form of invasive Group A strep or iGAS, when Group A strep bacteria enter parts of the body such as the lungs or the bloodstream. If you believe your child is seriously unwell and you're concerned that your child has iGAS, you should call 999 or go to the emergency unit, A&E, immediately. Symptoms that may indicate your child is seriously unwell include your child is finding it difficult to breathe, including if you notice grunting noises or their tummy is sucking underneath their ribs. There are pauses when your child breathes. Your child's skin, tongue or lips are blue. Your child is floppy, will not wake up or stay awake.